Okay, so we're going to move into the Q&A portion now. So thank you, Doreen, Stephanie, and Erin for a great and informative presentation. We have a ton of questions and not a ton of time, so I'm going to get through as many as I can. Just know as well that the Q&A is still accessible, so we can have the presenters continue to answer any questions that we don't get to. So jumping right in, Chelsea has asked, how do you recommend initiating a low barrier space such as this and getting buy-in from funders? How is the process, how is it working in conjunction with a, let's try that again. How has the process working in conjunction with a faith community been, and have there been any barriers? Oh, and you're muted there, Doreen. Doreen, can you unmute yourself on Zoom? Can have the presenters continue to answer any questions that we don't get to. So jumping right in, just mute your stream on the platform so we can just hear you.
How's that?
All good.
All right. Okay. We were trying to answer some of the questions as we were seeing them, but I don't think we got to all of them. So Stephanie and I are huddled together at Mission United, and Erin is trying to juggle 2 presentations, so we'll do our best. Can we just, some of the questions that I saw were about animals, and I think addressing, doing some things to assist the low barrier approach. And so maybe I'll just quickly talk about animals, and then Stephanie can talk about the low barrier approach, if that's okay. So we have a crate that if people won't access the services and leave their animals outside, we do have a crate for animals. We don't publicize that or necessarily encourage that, but we can adapt to that. And we have an organization in Durham region called Team Chelsea that we have linked with in the past to try and get support for animals, which was that little dog that you saw at the start. Mm-hmm. Yeah. And so the low barrier approach and some tips about that.
Yeah, so I think that it's really about questioning the reasons that we do everything that we do, right? So at this particular time, because we're in the midst of a pandemic, there are certain pieces of information that we are required to gather at the door. But really, outside of that, it was our intention from the beginning to limit the requirement of information. So, you know, because all of those things can be off-putting. So it really is about trying to put yourself into the experience of the individual who's coming through the service, and all those things that you feel might be off-putting, really considering why that might be and if it's really necessary. Because I think that we do a lot of things that are not required. And I think that those things do create barriers to service and to individuals desiring to return. So, I mean, some of the specific things that we do, minimal information as you move through the operation. So we gather a name just on entry. You know, we don't require any further information unless it pertains specifically to the service that that person is trying to access. So for example, if they're meeting with the Ontario Works team, there are certain details that the Ontario Works team will require of that person. Outside of that, if they're coming in to use the washroom or whatnot, we keep it to a minimum. They're, you know, they're asked to provide first name, and that's that. We do sort of integrate that low barrier requirement with safety, of course. So it's a constant balance. And I would say my best advice would be to really think about what you're doing, why you're doing it, and be sure that you work together to evaluate on a consistent basis, on an ongoing basis, and make changes where you feel something's not working well.
That's great. Thank you so much. There's a couple of questions about how you've navigated the sharing of health information between health partners and housing partners.
Yeah. So we've prepared a shared consent document, and that's something that was mirrored on the Health Links project that was piloted in healthcare over the last 4 years or so. And so it is information sharing that is detailed. All of the partners are listed. The purpose of the service is clearly laid out. And I would say, just back to the low barrier piece, all that type of information, those pieces of information, it needs to be accessible. So it needs to be in plain language, nicely outlined in a not too busy fashion, and people need to be able to glance at it, understand it, and decide if they're comfortable to proceed through the service. So that's how we've done it. So it's a reviewed consent on entry and then implied elsewhere throughout the operation. So it's posted at each service location. And then we certainly inquire if there are questions, but we operate as a unit, and that's made clear.
Yeah, and the other thing that we're working with is we
Can I get a coordinator to zone 3, please?
one of our we have several organizations on site that are on HIFAS, and so we're able to share some information through HIFAS, housing related information, and that's what we use to get people on the by name list in the building as well.
Great, thank you. A lot of people in the chat are very impressed with the rate at which you're housing people in Durham region. And there is a question about how you've been successful in getting so many people housed. So like, where are they being housed? Are you utilizing PHBs, that sort of thing?
I think that's a question for Erin. Erin, are you able to answer that? I'm just going to text her because she's in these two presentations, but really that's a credit to the region of Durham. They have a number of strategies. There are a lot of partners that are looking for housing and that are assigned to people from the by name list to walk with them to find housing. There also have been there's a landlord engagement strategy that's being used by one of the partners, so that they match people in one location, so a scattered site location throughout the region with agreements with landlords. So they have a number of strategies, and there also are some new capacities being developed that people are being able to be housed in as well. And if you want to go on to another question, I'm going to find Erin and maybe she can talk a little bit more about that.
Yeah.
Well, we're actually at time now anyway. So just as a reminder, the Q&A does stay. So if folks want to pop back in, and when Erin's done with her other session, she'd be able to come in and address some of those in the chat that we weren't able to get to. And there's a number of questions we didn't get to. Doreen, I saw you in there answering them, which is very much appreciated because people were very interested to hear from you guys today. So I just want to say again, thank you to all three of you for great presentations. Thank you to everyone who attended the session for engaging and submitting your questions. I'll just remind everyone that there is a session evaluation that you can find at the bottom next to the discussion tab, and we would love if you can fill that out. Otherwise, just a reminder that our keynote presentation from Tanya Talaga will begin in about 15 minutes at 12:30 Eastern. So thank you again, everyone, and we'll see you later.
We'll actually need to sign back into the session because I think I closed it so that we didn't have some, audio problems. So we'll sign right back in there.
We'll see you over there. Thanks again.
Okay. Thanks very much, Kat. Thanks, everybody.
Bye.